Weak bladder and urge incontinence are really similar in their symptoms, with the primary difference being that with just a weak bladder, the person doesn't necessarily experience bladder leakage. Both the weak bladder and urge incontinence will have strong bladder urgency to run to the bathroom, and both experience urinary frequency, sometimes going to the bathroom as often as every 15 minutes. But people with weak bladder, or overactive bladder as it's often called, don't totally lose bladder control before they get to the toilet. The bladder treatments for both the weak bladder and urge incontinence are pretty similar. Bladder treatment for both weak bladder and urge incontinence consists of 3 primary treatment approaches. Which bladder treatment is chosen depends on how severe the weak bladder or urge incontinence is. The bladder treatment options for urge incontinence and weak bladder are medications that help calm down the bladder, surgeries for the worst cases, and bladder training, which is a natural bladder treatment that teaches the bladder how to be under your control again. Bladder medications relax the bladder muscles of a weak bladder and calm down the bladder spasms that make a person feel urinary urgency. Some medicines improve urge incontinence by helping the muscles that keep the bladder closed to prevent bladder leakage. Two drawbacks to using bladder medications are the side effects of dry mouth and constipation and the ongoing costs. And then the other problem is that medications only manage symptoms. They don't really fix the weak bladder or urge incontinence. Bladder training for weak bladder and urge incontinence takes a few weeks and consists of teaching the person new toileting habits, examining dietary influences, and doing kegel exercises to strengthen the pelvic floor muscles that help with bladder control. Biofeedback may be used to help with learning kegel exercise techniques, as well as to monitor the improving strength and conditioning of the pelvic floor muscles. Surgical operations may improve the storage capacity of a weak bladder and lessen the pressure sensation inside the bladder. It's appropriate for people who are seriously constrained by urge incontinence or stress incontinence. Generally, every other technique will be attempted thoroughly prior to pursuing surgery. Do yourself a favor and try a bladder training program after consulting with your medical care provider. And have a great day as you begin to reclaim bladder control.